Hello, I'm Shivkumar, the editor-in-chief of JACC Clinical Electrophysiology. With me is Professor Harikrishna Tandri, professor at Vanderbilt and the director of cardiac electrophysiology, who's the editorialist of this paper. So Hari, thank you so much for joining JACC EP's podcast. Could you please tell us your perspective as an experienced operator of VT ablations, the impact of technologies such as what the authors have talked about using CO2 insufflation for epicardial access?
Thank you, Shiv, for giving me this opportunity. I'd like to thank JACC as well for having me here. It's quite an exciting paper from my perspective. Epicardial access has been confined to select centers with operators who do high volume epicardial ablations, and leaving a large majority of electrophysiologists who like to do these procedures but are not comfortable with the access aspect of getting into the pericardial space. What this does is basically democratizes this by reducing the risks of getting into the pericardial space by clearly defining it filling it with carbon dioxide, so you can clearly see on the fluoroscopic image with minimal morbidity of getting into that. And I think it's a really good move in the right direction, which will open epicardial ablations to centers which are low in volume and probably improve access to patient care across the United States.
Another quick question for you, Hari. The authors allude to this. Do you think that's going to be its own set of a learning curve for this type of a procedure?
It is, and our operators are quite experienced in cannulating the coronary sinus because of various reasons, because of IV pacing and so on and so forth. So I think the learning curve is going to be fast, and it will not add too much time to the procedure as well, and it can be very easily integrated into the EP space. So I think all the tools are in place, and it will be a very quick learning curve.
Thank you so much, and I can tell you that, as aficionados of catheter ablation of VT, it's nice to see after like almost 25 years, seeing newer approaches that are going to expand these procedures to help our patients. Again, Dr. Tandri, thank you so much.
Thanks for having me.